So I'm going to talk to you about the ultrasound-guided quadratus lumborum block, the chronic pain applications of this block. You can perform this injection for loin pain, hematuria syndrome, chronic post, nephrectomy pain syndrome, loin pain, or even also for visceral analgesia, visceral pain syndromes. You can try this injection. Quadratus lumborum can also be sourced for the back pain, and you can perform this injection for the spasms of the quadratus lumborum muscles. To perform this injection, the patient will be laying in the lateral position. The most important aspect here is the positioning, where the patient has to be laying perpendicular to the bed without twisting the spine, because if you have a twisting of the spine, unfortunately, you will not be able to see the transverse process and the vertebral body. So it's very important to align the patient perpendicular to the bed. We will be looking for what I call as a thumbs up sign, where you will have the thumb depicting the transverse process pointing towards the quadratus lumborum muscle. The rest of the hand is depicting the vertebral body. In front of the thumb, you have another muscle. It's a psoas muscle, and behind the thumb, you have another muscle. That's your erector spinae group of muscles. So erector spinae, quadratus lumborum, and psoas muscle, and that's called as a shamrock sign or tri-leaf sign. So to start with scanning, you will use a curvilinear ultrasound probe given the wider field of vision, and you can scan deeper structures. You will feel the highest point on the iliac crest, and the ultrasound probe will be looking down towards the vertebral body and the transverse process. And here I will freeze the image, the thumbs up sign, where you have a transverse process along with the vertebral body, which I'll draw it. So this is a transverse process, vertebral body. You have the transverse process pointing towards a hypoechoic muscle as compared to the other muscles, the quadratus lumborum muscle. The front muscle in front of the transverse process is the psoas muscle, and the muscle that lies behind the transverse process is the erector spinae group of muscles. Your aim is to bring the needle. You can do an outer plane technique, bringing the needle, or you can bring the needle posterior to anterior in plane technique, going on the top of the transverse process and injecting the local anesthetic and steroid mixture. Essentially, this will facilitate the paravertebral spread of the local anesthetic and steroid mixture, giving the visceral analgesia. If you carry on bringing the needle forward, going into the psoas muscle, this will give rise to the psoas compartment block. You can also put the catheter in the quadratus lumborum plane and continue the infusion to provide the continuous analgesia for the quadratus lumborum block.